Hi, my name's Kim,
And I'm Chelsea.
and we're going to talk to you today about the muscles of the face, the happy muscles.
And the sad muscles.
So, the first muscle that I'm going to talk to you about is the orbiculus oculi, and it's the muscle that surrounds your eye. It's a thin, flat sphincter muscle of the eyelid surrounding the rim of the orbit. It originates in the frontal and maxillary bones with ligaments, and it inserts on the tissue of the eyelid. Um, it allows you to close your eye, produces blinking, squinting. Okay, that's it.
The first sad muscle I'm going to talk about is the frontalis, and it originates in the epicranial aponeurosis. It inserts in the skin of the eyebrows and the root of the nose, and it raises the eyebrows and also wrinkles the forehead skin vertically, or horizontally, which is when you're frowning, and it is and the nervous system is the facial nerve.
The next muscle that I'm going to talk about is the levator labii superioris. And this is the thin muscle between the orbiculus aureus and the inferior eye margin in here. It originates on the zygomatic bone and the infraorbital margin of the maxilla, and it inserts on the skin and muscle of the upper lip. And it allows you to open your lips, raise and furrow your lip. I think that would be the Elvis lip.
The next sad muscle I'm going to talk about is the corrugator supercilii. It originates on the arch of the frontal bone and above the nasal bone. It inserts in the skin of the eyebrow, and this draws the eyebrows medially and inferiorly, which wrinkles the skin vertically when you're frowning, and it's also connected to a facial nerve.
Yeah, we're forgetting that. Next one I'm going to talk about is the risorius. It's a slender muscle, inferior and lateral to the zygomaticus. Its origin is lateral fascia associated with the masseter muscle, and it draws the corner of your lip up laterally, and you can tense your lips with it. And also innervated by the facial nerves.
The next one is the depressor labii inferioris, and this originates in the body of mandible lateral to midline. It inserts in the skin and muscle of lower lip, and this draws your lower lip inferiorly to make a pout like this, and it is innervated by a facial nerve.
Now I'm going to talk to you about the nasalis. It's a thin, flat muscle that covers the top of your nose. It compresses the nasal cartilage. Its origin is the maxilla part of the skull, and it inserts into the nasal bone. It allows you to scrunch your nose and also flare your nostrils, and also innervated by the facial nerves.
Next is the depressor anguli oris. It originates in the body of mandible below incisors. It inserts in the skin and muscle at angle of mouth below insertion of zygomaticus. It draws corner of mouth down and laterally to make a grimace, and it's innervated by a facial nerve.
I'm going to do my last two together because they kind of go hand in hand. They work together. It's the zygomaticus major and zygomaticus minor. They both extend diagonally from the cheekbone to the corner of the mouth. They originate on the zygomatic bone, and they insert in the skin and muscle at the corner of the mouth. These two are known as the smiling muscles. They raise the lateral corners of the mouth and also innervated by the facial nerves.
My next one is the mentalis. It originates in the mandible below incisors. It inserts in the skin of the chin, and it wrinkles your chin and protrudes lower lip when pouting, and it's innervated by the facial nerve. And my last one is the platysma, and it originates in the fascia of chest. It inserts in the lower margin of mandible and skin and muscle of corner of mouth. This tenses the skin of neck and helps depress mandible and pull mouth down, and it's innervated by the facial nerve.
So thank you for watching.
And we hope this shed some light on the expressive muscles for you.